Hello everyone and welcome to today's webinar, Challenging Behaviour number 3, Psychopaths in the Workplace. And our presenter is Nicole Nash-Arnold. Nicole is a nursing career coach who helps great nurses transform into respected leaders. She shares her 15 years of experience in both senior and executive health leadership roles to germinate great leadership. Clinically, Nicole has over 10 years perioperative experience before moving into her nurse educator and management roles. She has postgraduate qualifications in perioperative nursing and currently a master's in nursing. Nicole is a member of the International Coaches Federation. Nicole, welcome to the microphone.
Very much. I love the way you introduced it with saying psychopaths in the workplace.
I know. Nothing like a little psychopath, I think.
That's a positive subject.
That's right.
So yes, indeed, this is my third in a series that we've talked about challenging behaviours. Now, what I'm going to do is I'm going to orientate you a little bit to what we've already discussed in a couple of the preceding topics in the two preceding webinars. But before I get to that, I just wanted to give a little bit of a preamble about what we're talking about here. As I discussed in the first one when we unpacked what challenging behaviours were out there in our workplaces, what we're not talking about here is bullying. That is something that's outside the purposes of this conversation. And what we are talking about are those very select few people that are known as psychopaths in the workplace, and they're very toxic. It's a tricky subject because it's very emotional, and how we feel about engaging with those people usually spawns quite a lot of emotion, triggers quite a lot of anxiety, anger, resentment, frustration. It's very easy for those people that we get in contact in the world to overstate or underestimate the people that we are talking about in this context. And usually when we are encountering someone who's very toxic in our workplace, it becomes very all-consuming. So it's difficult subject to pitch it at the right sort of level. What we're talking about is probably 1 to 2% of the population who fall somewhere on a spectrum of behaviours, from challenging behaviours that are frustrating right through to full-blown toxicity and psychopathic nature in the workplace. So the sort of things that we're not talking about that we have talked about in previous episodes, webinars, are these sorts of things. And that's what we talked about in another webinar. So the people who we find their behaviours quite challenging in that they can be very bossy, they can be incredibly brutal with their feedback, intolerably lazy, that the busy person, the one person that's always constantly busy and fussing around with everything in their life but never actually very helpful and effective. The challenging behaviour that's the very bizarre, that can be treacherous. They're always going behind people's backs and saying things. The know-it-alls, the highly critical individuals, and the very combative. They're the sorts of behaviours that we talked about in terms of, in our nursing world, the behaviours that we need to challenge and put fences around. And we don't necessarily do all of that well in our world. So knowing when to challenge those behaviours has been important. So what we talked about then was, what's the threshold? Does it affect team cohesion? Does it affect patient care? That's the sort of thing that we need to assess and consider when we're dealing with challenging behaviours, not necessarily psychopathic or toxic, but when we're dealing with challenging behaviours. When you're dealing with any of those behaviours, then we need to say, is it affecting the team? Is it affecting the patient? And if it is, then we need to deal with it. And we deal with it through the use of those sorts of techniques in the way in which we have a conversation. We use compassion, we make requests, we deliver an expectation. We deal with that problem with respect, and we look for follow-up. We go back and have that conversation. We use a model that we can scaffold around that behaviour, around that challenging behaviour, so that when we are having that difficult conversation with a challenging individual, we can say to them, this is a situation, this is the behaviour, this is the impact. And we also used a perceptual position where we can identify other perspectives which may provide some real reveals for you when you're dealing with that situation. And it's a model that you can plan and think through the conversation you're going to have with the person with challenging behaviour within difficult conversation. And we also had a look at transactional analysis, where we look at how we can make sure that our conversation with challenging behaviours or people that display them stay in that adult to adult and not parent to child. I bring that up and give you that background when we're talking about challenging behaviours, because none of those will necessarily work when we're dealing with the behaviours that we're going to talk about today. They are excellent techniques, and they're the techniques that you must use when you're dealing with someone who's displaying challenging behaviour, that you want within the fullness of your heart to get them back on track, and you expect them to meet you halfway in a very reasonable manner. The problem when we're dealing with toxic people in the workplace is that you're dealing with quite a different animal, so to speak, and the behaviours and their responses are not what you would expect from other people. Sometimes we can say, and there is an analysis for saying that they may fall on the personality disorders and have some sort of level on that spectrum. And you can bet your bottom dollar that those sorts of challenges are going to impact the way in which you would normally approach a situation, the common ways that you would normally. So now we're going to unpack what sort of people we are dealing with when we're dealing with the very toxic people in our workplaces. There is a very firm body of knowledge around a constellation of 3 socially undesirable personality traits, and they're known as the Dark Triad. The first one is the narcissistic, and comes from the narcissus, the Greek word. It's a great story in its background. It comes from the hunter who fell in love with his own reflection in a pool of water, and he drowned. Narcissistic people, selfish, boastful, arrogant, completely lacking in empathy, and they're hypersensitive to criticism. All of those are really important to think about and remember, because we will delve deeply into those in this webinar, because they are the hallmark symptoms and of what you're dealing with. So the approaches that a reasonable person would take does not work with people that display these narcissistic qualities. The next one of the triad is Machiavellism. And the word comes from a renowned 16th century Italian politician and a diplomat. He earned his notoriety with a book called The Prince, which was interpreted as an endorsement of the dark arts of the cunning and the deceitful in diplomacy. Traits associated with this are duplicity, manipulation, self-interest, and lack in both emotion and morality. So if anyone has been watching Game of Thrones, you're sure to see that sort of behaviour when you see the diplomacy in that show. It is a classic example of what you might see in the Machiavellism. The third is the psychopathic amongst us. Personality traits that are associated with this include a complete lack of empathy and remorse, antisocial behaviour, being manipulative and volatile. There's a distinction between these traits and being a psychopath and the currently held association with criminal violence. So clearly we're not dealing with that element of it, but just those traits or those tendencies rather than what's been full-blown in that area. Now, research on this dark triad has increased exponentially in the last decade, or coming up now 2 decades. There are many subtleties and grades of these personality types and the behaviours that are associated with them, and what's important is that they can change from day to day. So when you're dealing with a member of the dark triad, the behaviour that you see today doesn't necessarily seem the same tomorrow. It's something that important to deal with those negative behaviours so that you can develop some level of harmony, particularly in our workplaces. In our clinical settings, we're dealing with challenging situations anyway, increasing workload, increasing acuity, lower skill mix perhaps, lots of challenges that are going on in our workplaces. And if you add this into the mix, then you have got a team that lacks harmony and cohesion by nature of the behaviours that are exhibited by these dark triad. So it is important to be able to deal with those negative behaviours, but it is not easy. Productivity will often be radically compromised by the behaviours that we will unpack further. And there's sometimes some very unethical decision making that goes along with the people that fall within this. There is almost certainly dishonesty, certainly a lack of humility. And these are almost always the toxic individuals that you are coming across. With men, they particularly manifest into being more aggressive in their workplace relationships and try to influence people and events more forcefully. The narcissistic people are initially become quite endearing to us. And the difficult part about these sorts of behaviours that we see in the dark triad is that they can be quite seductive. Someone who is a narcissist can often be incredibly magnetic. Their personalities are really great and they come into a room and they own a room and they talk about, namely themselves, but they come with a self-confidence that most of us would dearly love to have. So it's very easy to be seduced by them and really love a lot about these personalities because of the nature of the way that they behave. But ultimately, they may come across positive and desirable in the beginning, but they only make an effort and seem charming and friendly when it is in their advantage. Hence, the constant me tendency can become very wearing when you're around that. The dark triad are only interested in getting ahead, and even if that means that it doesn't mean that they don't get along. Get ahead, they don't get along. The high self-esteem gives them a yearning for leadership, which is a little bit of a danger zone for us because it is likely that these toxic people is someone that we work with in a superior situation. The management gradient is tilted to their favour because they yearn for that leadership. So they might be a clinical nurse specialist so they have seniority in terms of their clinical expertise or in some sort of management gradient. They have such a focus on achievement and they have very little concern about the effect that their ambition might have on others and very good at portraying themselves in a very positive light. Now, Gordon Gekko in Wall Street is an excellent example of a very classic member of the dark triad, and he displays all three of those characteristics of complete manipulation, duplicity, self-obsession, and some psychopathic traits in terms of his behaviour. So it's a good one to look at in terms of how you might want to understand what these people look and feel like in everyday life. There's an excellent scale that a psychologist developed in 2010 called the Dirty Dozen Scale. It's a 12-item methodology and it's quite well validated and it's very specific. There has been an enormous increase in interest in the nature of toxic people in the workplace in that same period of time that all of the research has developed over the dark triad. So to better understand that, these psychologists developed this validated 12-item measure to develop these three characteristics: the narcissism, Machiavellism, and the psychopathic nature. And in fact, there's been about 1,100 participants in the study that they have held. At a basic level, people rate themselves from 1 to 7 on the scale of the 12 tests, and they can scale somewhere between 12 and 84, where the higher the score, the more probable that they're going to have dark triad tendencies. So these are the 6 of the 12 questions, so that one might manipulate, use deceit, that they have used flattery to get my way. It's interesting language, to get my way. They exploit others to my own end. I lack remorse. I tend not to be concerned with the morality or the morality of my actions. Callous or insensitive. I tend to be cynical. They want others to admire me. I want others to pay attention to me. I tend to seek prestige or status and special favours from others. So when you extrapolate the key words out of that scale, you start to get the signs and symptoms of who you might be dealing with when you're dealing with someone with the Dark Triad, or the toxic person in your workplace, or your psychopath in your workplace. So when we look at those, they are characteristics such as that they tend to manipulate, they're deceitful and they lie, they flatter, they exploit others, they lack remorse, they are unconcerned with morality, they are callous and insensitive, they're cynical, they want people to admire me, pay attention to me, they seek prestige and status and they expect favours. They are the classic behaviour traits of someone who is a member of the Dark Triad. These people truly believe that the world revolves around them. They want to live out their fantasies that they are the smartest, the most talented, the all-round best people in the world. They have grandiose fantasies and they're absorbed with themselves, and everything is calculated to deliver the right impression. As I said before, they are quite seductive. When we view them from a distance, they're great politicians, they write incredible music, they write wonderful books, they get Nobel Prizes, and they are unapologetically fabulous in a lot of senses of the word. But they use people unapologetically as well. Eventually, when we get to know them, we resent them because they ignore our needs. So they are often, in addition to these signs and symptoms, there are other things that you might find in them, that they're very coercive and that they won't take no for an answer. They feel like the rules don't apply to them. They almost feel like they wrote the rules. Their needs are far more important than yours. It's never their fault. No matter what happens, it's never, ever their fault. They seek instant gratifications. One of the most interesting parts about people that you're dealing with in this space is that they throw tantrums. We'll talk about that a bit later in terms of what that tantrum looks and feels like, but it is a classic tantrum. They're often very entitled, always very competitive, and they're easily bored when the topic of conversation is not about them. And you'll actually watch them glaze over with boredom while they try and squirm out of that situation or manipulate the conversation back to them. Now, in addition to this concept of the Dark Triad, which has got a considerable body of knowledge, there is a great book that if you are dealing with someone who you would say fits those signs and symptoms, there is a great book called Emotional Vampires, and it's by the author Dr. Albert Bernstein. Now, this man is a PhD, he's a clinical psychologist, he's also a business consultant. And he deals with the members of the Dark Triad, but also in the context of the 5 most common personality disorders that we see in our community. And he has this excellent way of determining who those people might be as opposed to the rest of us. So he has a great quote that when people are driving themselves crazy, they have neuroses or psychoses. When people drive other people crazy, they have personality disorders. And these are the sorts of people that we're dealing with here, that they have an enduring pattern of inner experience and behaviour that deviates markedly from the expectations of the individual's culture. And it's usually manifested in one of 2 or more of the following areas: the way of perceiving and interpreting themselves, others, people and events, range, intensity, lability and appropriateness of their emotional response, interpersonal functioning and impulse control. Now, that's a really important point in terms of what we talked about in the last 2 webinars when we're dealing with challenging behaviours and how you might use the situation behaviour impact feedback model, the perceptual perceptions or the transactional analysis. The reason why these techniques won't work on members of the Dark Triad is because their interpersonal functioning or their emotional response or their way of perceiving deviates markedly from the norm or our culture. So it's very difficult to apply those because the rules changed. All of a sudden, all of those rules, when you're engaging with everybody else that possesses challenging behaviours, the rules stop applying and the techniques stop working. Now he delves into, there are 11 of personality disorders. He deals with 5 of the most consistent that lives in our personality, in our lives, communities and workplaces: the antisocial, the histrionic, the narcissist, the obsessive compulsive and the paranoid. He makes a very important point all through this book that they are very seductive. And the reason that he uses the analogy of emotional vampires is that vampires can't see themselves in the mirror, which is to say they have absolutely no insight. And that's important when we move now into how you might deal with these members of our community or our workplace, because there's no point in trying to get them to gain insight. There's no point in getting them to try and understand how you see them, because they have no insight and cannot see themselves in the mirror. So that's a really important part about how, when we move through this, how important that is to remember, because you're dealing with a very different set of circumstances than you are in the normal cultural way that we would deal with situations. So how to protect yourself. One of the most important things, and what we will talk significantly about as we move through a bit of a how-to now in techniques, is know your goal. One of the most dangerous things is to believe that you can change this person, that underneath it all they're misunderstood, or that they're just like you. Members of the Dark Triad are not just like you, and they are not misunderstood. They are just completely deviate from the way in which they perceive and respond. They don't do any of those sorts of things. So you, particularly in the workplace, you have to know your goal. Our professional goal with our work colleagues in this context is to work well with people professionally so that we can deliver excellent patient care. That is your goal. And it is a team sport. Nursing, for all intents and purposes, is a team sport, and it's a contact sport. A lot of the time we have to work with other people. So your goal should be to have a professional relationship where the relationships contribute to a harmonious team so that you can get on with the business of delivering excellent patient care. Outside of that, you need to separate from that. Second most important tip is pick your battles. No matter how frustrated you might be and how angry the behaviour might be, or how incredulous you are that they could respond in a certain way, or how toxic and destructive, you have to pick your battles. It's one of the things about when I have covered this content in the other 2 webinars, when I talked about what is your threshold. Again, does it affect team cohesion and does it affect patient care? That should be the trigger for you to know when to pick your battle. If team cohesion is being affected, which it likely is, then it needs to be dealt with. If it's affecting patient care, it needs to be dealt with. But it is not your mission to pick every single battle to take on. You have to pick the right time and place to be able to get a really effective outcome. Recognise their seductive qualities is my 3rd tip for you. When they enter a room and they're absolutely fabulous and they hold court and they can tell a great story and they're incredibly magnetic, and you aspire to have the level of self-confidence that they seem to have, recognise that that's not a normal way to respond for those people who are very, very narcissistic. It is very, very easy to get wrapped up in their own grandiose stories. When they tell fabulous stories about all of the things that they have done, then it's important to question that and whether it's centred in reality. Certainly one of the members of the Dark Triad that I have had close professional relationship with, because we were both managers of a very similar department and worked closely. After some time, I started to think that this individual would have to be 152 to have done all of the fabulous things that the person had claimed that they had done. And it ranged from Olympics to professional associations to study and money in the bank and cars that were driven, and everything was grandiose. And so it was appealing to be wrapped up in these great stories. But it was important to be able to recognise that something's amiss here. Choose your words carefully. You are dealing with someone who is a master manipulator. The level of their deception, duplicity, manipulation, ability to lie is far and away advanced than you will ever hope to achieve. So in a way, you're getting into a ring with a 600-pound gorilla in terms of their skill level that you're trying to get in terms of taking them on. So you need to choose your words very, very carefully, or you'll lose control of that situation very, very quickly. In terms of how to, when you are managing the Dark Triad, then there are 5 main techniques, and it's very well explored in the book Emotional Vampires. And Albert Bernstein makes the point that actually a lot of the time the techniques that you would apply to a member of the Dark Triad is not dissimilar to what you would apply to a small child. Set limits, be consistent, keep lectures to a minimum, reward good, ignore bad. Now, these are not the techniques that you would use for someone who's challenging behaviour who is outside a member of the Dark Triad. But it is someone for here because, again, you're getting into the ring with a 600-pound gorilla and you need to be able to use techniques that are different to what you would use normally or culturally. So if we look at those a little bit more deeply, set limits. It is important for you to draw an emotional curtain around their behaviour and your emotional response. Recognise that their behaviours are toxic and there's a time that you must disengage from them. As nurses, we inherently come with compassion and a need to help and a need to fix. This is not a time for helping and not a time for fixing. The very toxic people in your workplace don't want fixing. They think they are perfectly fabulous. In fact, they are far and away more fabulous than anybody they've ever met in their lives. They don't want to be fixed. They don't want to be helped. So when you become emotionally invested in trying to help them because you can see the distraction in their wake, then you're going to be on an emotional pathway that is end in despair and will have absolutely no result in terms of positivity. Sometimes it's worth limiting your exposure. That's the professional part. What's your goal? Know your goal. Your goal is to work well with this individual so that you can resume normal core business, deliver excellent patient care. So expose yourself to them as little as you need to be able to execute your goal. Get outside verification is important about setting limits. It's the same with the manager that I used to work with who needed to be 152 to have done all of the things that they had claimed that they have done. It's important to get outside verification because if you do believe their story, you're getting wrapped up and you're getting sucked along this seductive journey only to be very disappointed or look very, very foolish. So outside verification, it's a lot easier to let go and to be able to remove yourself and have some distance with this person when you've got that outside verification of what's true and what isn't. Then you can go forward and make a decision about what you're going to do with that information that you know to be factual as opposed to what has been espoused by a member of the Dark Triad. Don't let that person be the source of your information about themselves or on any topic. If it's the information about themselves, then certainly get outside verification. But if they're telling you information about what's going on in your clinical department, then you can almost certainly bet that it is duplicitous, it is deceitful, it is manipulative in its nature. So if they're your only source of information and you're making decisions or engaging with people in a certain way as a result of that information, then you're walking a very dangerous path. So that outside verification is important about setting limits for how much exposure and buy-in you get with that person. Narcissistic members are the most draining because they constantly talk of their own legendary status and they talk with complete insensitivity and they alienate people. So Being around those people is ultimately toxic, and setting those limits of your exposure is important. You need to get what you need and then leave it at that. If what you need is to work collaboratively with them because you're in a team nursing situation and you need to make sure that the antibiotics are delivered, the cares are delivered, the doctor's rounds are executed, the orders are followed, then get what you need from that person and then remove yourself from them. Consistency is incredibly important. Let facts, not emotions, determine your response. When they behave badly, let the facts determine your response, not how angry you feel, frustrated, completely sick of this behaviour. Don't let any of those things drive your behaviour, because they're masters in this and they want to be able to get that reaction from you. So developing techniques to consistently send them the same message is really, really important, and respond the same time every single time. Their words are almost always lies or partial truths. So it's important for you consistently ask for detail for you to understand what's really going on, that you consistently demand accountability. Narcissists are classic for cutting corners because they want all the glory at the end but get bored in the middle. So they want to manipulate everybody to do all of the work and then swan in at the end and claim that they did all of the work. And if it wasn't for them, then the whole world would have fallen down and the patient care would be terrible. So when you're in a situation where they're reporting to you in some way, perhaps they're in your team, then you must delegate and consistently check in and consistently ask for deliverables. Have those antibiotics been given? Have you seen the doctor's orders? Have you followed this? Have you got the patient down to X-ray on time? You will need to consistently find that. And they will learn that consistency, they will learn that you won't allow them to cut the corners and then swan in and pick up the glory. That you've recognised their technique and you're not going to let that happen. So you're giving them every opportunity to follow the rules. When a member of the Dark Triad hasn't gotten their way, and you're trying to get them to do something they don't want to do, then you're almost certainly going to be on a pathway for a reaction. So in the first instance, follow the rules about being consistent. Be clear as possible about the behaviours that you want and consistently following them up. Now, when they do start to behave badly and they start to display their classic traits of manipulation, of deceit, exploiting others, lacking remorse, seeking prestige and status, then it's important for you to keep your lectures to a minimum. It's frustrating behaviour. It's really easy to lose the plot with them, but it doesn't help. In a situation where you might feel embarrassed if someone was to call you out on manipulation or a lie that you have told, that you would feel guilt and you would feel embarrassment and that you would correct that. These people don't feel that. The characteristic part of their behaviour is that they have a complete lack of empathy. So they have completely devoid of guilt, embarrassment, any of those other emotions. And all they want is attention, particularly the narcissists. So when you are dealing with that, then you are giving them attention. If you're giving them a lecture, then you're giving them attention. Any attention is good attention. It's not like you and me, where the dressing down in the tea room about our behaviour would just mortify us to our very core. They're very, very different, and they love it. They love any attention, because then they get a soapbox to speak from, and they can do that in the tea room with everyone else about how they're a victim and they're the best and no one understands me, and you're giving them oxygen to that bad behaviour. They do not possess the same emotional reflexes that we do. Lectures are good, and that's why they are completely ineffective at changing their behaviour. They're almost is certainly going to ignite a tantrum or anger, which is a classic hallmark of the Dark Triad. This is where it's important to pick your battles, because if you're going to get in the ring with this 600-pound gorilla who is highly expert at manipulation and highly expert at drama, then it's going to be very, very difficult for you to control that situation, which is why lectures to a minimum is important. Never take action when you're angry. These guys have no interest in developing awareness and will ignore absolutely everything that you have to say. Mostly, they're entirely unaware of what they're doing. Remember, vampires can't be seen in the mirror. So that you're telling them something that they just 100% disagree with, that they cannot see, have any insight. It's important to, if you are going to engage them, there's a few techniques which we will talk about later. But instead of lecturing, then it's important, like with any toddler, to reward good behaviour. Be absolutely clear about the behaviours you expect, because the best behaviour programs for members of the Dark Triad are the same that work for small children: positive reinforcement. Be absolutely loud and lavish with the praise that you want to see from them, and do it consistently and repeatedly. Praise them for the smallest achievements. Now, the bad behaviour is something different. Now, obviously, when we're dealing with other people, and I've spent another 2 webinars dealing with how ignoring bad behaviour is not the technique. So when there is bad behaviour, then we obviously need to deal with it so that we have a harmonious workplace. But the bad behaviour that I'm talking about are the tantrums. They manipulate you with their bad behaviour because it works. It's the same with keeping lectures to a minimum. You may feel that you would be mortified to be lectured about a lie that you had been caught out on. They feel none of those things. No embarrassment, no empathy, no mortification, none of the emotions that we have. So when they behave badly, again, the same applies. You may feel like you would be completely mortified if you were to behave in this way. They don't have that emotion. So there's no guilt, no embarrassment. And the reaction that you send when they display bad behaviour or throw a tantrum means that they're going to get anywhere. They're going to get you. They feel like you're getting somewhere. They're getting somewhere with you. And they're slowly starting to succeed. Now, the bad behaviour that I'm talking about these are the sorts of things. The emotional outburst, which only purpose is for you to give in and for you to be ultimately be manipulated. They might yell, they'll cry, they'll pout, they will lecture, they'll give you the cold shoulder, they'll induce guilt in you, despite the fact that they don't have any. They'll throw an actual tantrum of yelling and storming around the clinical department. 2 important things to remember about Dark Triad tantrums. The very fact that they are throwing a tantrum means that you are winning. It means that you've set limits and you're not being wrapped up in their seductive behaviour, that you've been consistent. You haven't allowed them to cut corners and swan in at the last minute and take the glory. That you've kept lectures to a minimum and they're starting to feel like, their normal strategies of manipulation, duplicity and deceit aren't working. And that you've rewarded good behaviour, but this is something they want to manipulate and you're not giving them what they want. So the sign that they're throwing a tantrum is that what you're doing is effective. It's important to hang in there no matter what. If you give in after the tantrum starts, it only teaches them to be persistent, because now they've realised that ultimately it works. Just like with the toddler in the supermarket, that now the toddler knows exactly how far he needs to go with mum to get her to buy the chocolate that he wants. And so that's the point at which he starts immediately. And that will be the exact same with your Dark Triad. So incredibly, incredibly important to ignore that bad behaviour. Ignore them, ignore all of those sort of things. Avoid the punishments, they just don't work. There's a couple of classic techniques that you can use to ignore those sorts of tantrums. An old psychologist tricks is with tears. Don't let the topic of the tears or the fact that they are falling constitute your conversation. Pass them a tissue and carry on talking about what you were talking about. Another classic is the cold shoulder, when you are like, everything okay? And they say, yes, really? Because you really seem like everything's okay, it's fine. And then there's the huffing and the puffing and the cold shoulder and the dirty looks and all of the non-verbal cues, and you go back to them. It really seems like there's something that's not the matter. And then you go back to them, cold shoulder, and they constantly you're going back to them. The technique is at the beginning. Is everything okay? Oh, yeah, I suppose so. Great. And then move on for the rest of your day. That's the sort of bad behaviour when you're dealing with the Dark Triad to execute. When it compromises team cohesion and patient care, then that's different. But if it's not, then ignore the bad behaviour. The crying, the tantrums, the carry on, the lecturing, the holding court, the sulking, the pouting, all of those sorts of things, ignore them. It is the best strategy. And one of the classic tantrums that the Dark Triad will throw is anger. And there's a great Mark Twain quote that I absolutely love about anger, that it is the acid that does more harm to the vessel than anything onto which it is poured. That's really important for you in terms of when you're setting limits. When they throw their tantrum and that anger, then it is more harmful to them. It is the extrapolation of their inability to control their normal emotions that you and I possess that they cannot. So it's important to just distance yourself from it. It's part of the setting of the limits. But there's a few techniques for anger management that plan your argument. When you are dealing with an angry person, they really believe that it's come from nowhere, that they're happily moving along in their world and there's something happened external and everything else made them angry. So you're not going to get a lot of insight from this person about how to deal with that effectively. So they're not aware of the fact that they use their anger to manipulate you. They see it as emotional outbursts out of nowhere. But you should deal with that as it is. It's their possession. It's their emotion, not yours. So plan. And there's a great quote that says, once you are angry in a situation, then it's really hard to communicate with your neocortex. That's why planning your argument before you get into an aggressive situation and you get into the ring with the 600-pound gorilla, that you've thought out what you're going to do. Map out your minefield. What actions and issues are going to bring on the tantrum? Find out what the things that you are most reluctant to engage with your Dark Triad member about, and that is almost certainly the areas where you've got some minefields. So know that. That helps you pick your battle, that helps you set limits, and that helps you deal with the emotions because you know what the triggers are going to be. Again, pick your battles. You want the angry person to be controlled, and you be controlled by what they do, not what you want them not to do. So you have to stay focused on what you want them to do, not the negative behaviours, what you want them to do. Classic is pick one at a time. They will be incredibly excellent at being able to deal with, well, what about this when this happened the other day, and be able to bring in all the extraneous variables to be able to, like the 6th one, pull you off course, but deviate you. It's a classic manipulation. So you have to be consistent and just pick the one issue that you're dealing with. No, we're not talking about the break that you had earlier and why you had it at that time. We're talking about why you were 45 minutes on your break and everybody else has struggled. That's what we're talking about. No, we're not talking about the fact that Jane had a 45-minute break 3 days ago. We're talking about your break today. Really important to pick the one battle and stick with it. Best defense is a good offense. Know your objective and choose how and when to ask for it. So don't wait for them to be angry or explosive or tantruming. Find and manipulate yourself a time to be able to have that conversation and take it on the offense rather than them come barreling up to you in anger, in a rage with the intent to manipulate you. Again, as we said earlier, don't get pulled off course. The favourite strategy of the Dark Triad is to get you angry. It's a classic because then the control is back to them. The most effective strategy for them to regain control of the situation is have you wild, and then they're in their masterful territory. They're much more likely to win. Ask questions, don't make statements. If you're going to take the high ground, the most effective way to do that is to ask questions. It's much more useful, it's much more effective, and far less noticeable than you making accusations or making statements. They will make them much more defensive, and they will be able to throw it back at you when you're making statements and be able to deviate you off course. So ask them questions and resist your own reflexive answering. When they make an accusation, then don't just make statements and make reflexive answers. Don't automatically go, no, that's not what happened, and then going off. They are masterful in this territory. So it's incredibly important that you ask questions, not statements. Now, when we're talking about questions, then there are a few questioning techniques, because this will be the most effective way of you maintaining control with a 600-pound gorilla that you've stepped into their heartland, where they are very, very skilled. So the technique of using open and closed. Open questions elicit long answers, closed short. There is a time and place for closed questions. This is a good place for it. You can get in a sense of their understanding, and you will get a much better, be able to corral their responses in a much better way if you ask closed questions. Another technique is using funnel questions. Now, this technique involves starting with a general question and then honing in on each point after each answer and asking for more and more detail at each level. When using these, start with closed questions and you can progress through the funnel, start and using more open questions. But if we're going to take the break, you can say, I understand that you've taken a 45-minute break instead of a 30-minute break. Is that true? Yes or no? Yes, it is. How did that come about? It came about because I had, someone else, it was someone else's fault and they did this. Tell me about someone else's fault, what happened there? And you just go ask a question and you just funnel it so that you can control their anger and keep it in control and get to the bottom of what you're trying to ascertain. What is the outcome that you're looking for? Leading questions are great as well because they start with an assumption and you're leading this person to the answer that you want. And they'll be so enraptured with their own rage and intent to manipulate that they will miss the fact that you're using leading questions. So you can say, how late do you think you will be off tonight? Now, this assumes that the person will not be able to complete their tasks on time. So you've led them to a solution and part of the conversation where you've already made an assumption. The other excellent thing about leading questions is that you can give people a choice between two options, both of which you are happy with, rather than the choice of one thing or them coming up. So you might say, which would you prefer, A or B? Would you prefer to work overtime or would you like to hand over to somebody else, rather than having them rage on? It's an excellent technique with the Dark Triad because people will get caught up in deciding between the two preferences and not creating their own solution. So you maintain the control in an area where you are at a significant disadvantage. Great for diffusing a heated situation. You can calm one of the Dark Triad by using funnel questions to get them to go into more detail about their grievance. It will only distract them from their emotions, but you will help you identify a small practical thing that you can do, and it will make them feel like they've won something and they'll no longer be angry. Now, they don't want to feel like they're backed into a corner, so asking a series of questions will help you to embrace the reasons and their own point of view. Now, the other thing about this particular group is they are exceptional liars. So a few tricks on being your own lie detector, because most of us who have normal emotional responses look to people that they mean well and they're being fundamentally honest. But the members of the Dark Triad are not, and they are expert liars. So how you can identify that is that lies are generally vaguer than the truth. There are very few specifics when the members of the Dark Triad speak. So it's usually that awareness that gets you sort of thinking, there's not a lot of detail, not a lot of substance here. And you can beware of people who don't answer questions directly. It's a sign that they are lying. Lies are often more complicated than the truth. So the simplest answer is often the truth, but when a member of the Dark Triad approaches you with all of their stories and the grandiose and all of the details, and it was so-and-so and it was someone else and everybody else's fault, there is all of this complicated storytelling. It's because the bare truth is yet to be told. They will often swear that they're telling the truth. When you and I are telling the truth, we don't need to, I swear that this is the truth, because most people trust us and know that it is. But if they're swearing that they're telling the truth, it is a case of the lady doth protest too much. So it's a warning sign that you're on the path of someone who's lying. Now, one of the things is that when you and I lie, we generally we lose eye contact because with the guilt that we feel. These members don't feel guilt, they don't feel embarrassment, they don't feel shame. So they are perfectly capable of looking you in the eye when they're telling you a lie. So be careful of relying on eye contact as a sign. They will exploit this conception that more eye contact means that they're telling the truth. And they'll manipulate you by all of those behavioural cues that we read in other people, and they will use all of them against you. Now, if they're lying, it's usually because there's some benefit. So it's important for you to say what is in their benefit. What do they achieve when they tell this lie? And it's a reason, if you've got some sort of sense that there's a benefit to them by selling you this story, then you're probably on the ticket for detecting a lie. Repeat behaviour, liars are always repeat offenders. Once you've caught them in a lie once, then it's probably likely that you're going to in the future as well. And the old adage of if it's too good to be true, it probably is. If it sounds too good, then this is the most reliable method of distinguishing truth from falsehood. But it's often the one least used. If they're telling you something that you want to hear, no matter how unlikely it is, then you are likely to believe it. So if it is too good to be true, then you need to really question the premise and whether it's a truth or a falsehood. So a couple of techniques and a couple of reveals for you in this process of identifying who might be members of this dark triad and what you can do about them. The most important thing to remember is that these people lack the normal human emotional responses that we do. So using the techniques that you would in everyday world won't work with these people. So that you must use those techniques that work with small children so that we are able to get in control of them. So they're the things like setting limits, be consistent, keep lectures to a minimum, reward good and ignore bad. And don't expect that they are going to respond in the way that you would in a situation. Now, as usual, I've got a whole stack of resources on my website, so nursemanagerhq.com/challenge#3 for you to get and have a look at more information. I'll have a link to the book, which if you are in a situation where you want to know how to deal with an emotional vampire, it is an incredibly insightful book. As well as the tool for the Dirty Dozen scale, so you can be reminded of what sort of characteristics that you'd be looking for in a member of the Dark Triad.
Nicole, as always, a fabulous presentation. Thank you very much.
Pleasure.
My only concern is I noticed some of those issues in my own personality, which is unfortunate.
Oh,
So for those of you who are listening to this webinar live, we've got a little bit of time left if you wanted to ask a question of Nicole. So to do that, you click on the question mark icon, a box will appear, you type into the box and hit send, and that will go through to Nicole. But that is true, isn't it? It depends on the day as to what personality traits you display. You only hope that you don't display them all the time, and maybe there's a fine line between a functioning person and a psychopath.
And I think that's why it's so difficult, because some days you can love a psychopath and the next day they're just going off their trolley with this raging tantrum. But their motivators are so very different. Yes, so Linda's just commented that she's met a few of the triad in my years of nursing. I have met many and they are so difficult. And to be honest, I think there are a lot of doctors that display those narcissistic personality traits, and that can be really, really difficult, but nurses as well. And we feel like that, we're a caring group and we come with empathy, but not everybody does. So, it's so difficult to deal with them because they're so vastly different on any given day.
Yes, that's exactly right. We just need to be able to steer them into a branch of the profession where they can use their powers for good.
Yes, and there are lots of powers for good that they can, be really, really effective.
Yeah.
But, managing that well when you have to work with them can be an emotional journey on us, on the normal of the community, and they get to breathe through and go, oh, great, job done. Everything else is great.
I have no idea what's wrong with those people, but, I'm sure they'll get to the bottom of it.
Yeah.
Interesting. Nicole, thank you very much. And as Nicole did say, I encourage you to visit her website. She does provide fabulous resources and also does a number of other courses that you might be interested in looking at. So, Nicole, thank you very much for a fabulous webinar.
Absolute pleasure.
To everyone who's listening, I wish you an absolutely exceptional day, and I look forward to seeing you online at another webinar very soon. Goodbye.